guess we should start. Yeah. Okay. So, so I think people are sort of trickling in after the morning's work. So let me introduce this session. I'm actually the moderator, Simon Lamb. I'm working the education and academic affairs team in the faculty, and very much thanks to the organizers, including Dr. Joyce Lee and also Alfred for organizing this time. And so today we're very honored to have Professor David Carless with us, who will be introducing or sharing elements from his expertise in feedback literacy. So as you probably all know, Professor Carless is an expert in feedback literacy, and in the past few years, he's actually literally revolutionized and solidified the literature within this field. So I think we all, as teachers, have trouble with feedback, receiving feedback, giving feedback, and actually having a good framework, and also knowing, the potential pitfalls, how to give good feedback, how to integrate it into curriculum. That's always been something of great interest to educators in all disciplines. So Professor Carless is obviously an expert in this area. He's published extensively in this field and also has received many awards as a teacher and also fellowship schemes and so forth from the Hong Kong University and also from faculty and international institutes. So without further ado, I'd like to introduce you to Professor Carless and his topic for today, which is student and teacher feedback literacy for the medical curriculum. And before I let him talk, I'd like to urge you also to remember to take note of the content and then give some constructive feedback at the end to both the organizing team and also to Professor Carless. Don't just tick off the Likert scales. Do give some feedback which is constructive and tells us how we can improve. So with that, I pass the stage to Professor Carless. Thank you.
Thank you very much, Simon, and it's a pleasure to be with you today. So feedback literacy is basically the skills that students and teachers need to make the most of feedback opportunities. And as Simon has already hinted, there's often some nervousness and anxiety and difficulties around giving and receiving feedback. I've been doing feedback research for more than 20 years now. And I think one of the things that sustains me in feedback is that I can now keep seeing its implications for daily life, how you get on with your spouse, how you get on with your children, how you get on with your colleagues. So to me, feedback is everywhere and potentially powerful, but we know it's difficult to manage successfully and difficult to manage effectively. So I've negotiated a bit with Simon and Joyce, as Simon just said. The proof of the feedback pudding is in the action, isn't it? So I've been doing these talks for 20 years. I've just looked at my CV yesterday. I've done 60 to 70 talks around feedback, but I don't think anybody gave me much feedback on how I could do better next time. So please, please, please do me a favor. You can, if you want to, you can start with something nice, but be something critical. If I was going to do this talk in 2 years' time, if you were kind enough to ask me back, how could it be better focused? Because that's what feedback is about. And I think as educators, it's very important that we model humility, willingness to reveal vulnerability, and openness to feedback. Because unless we show openness to students, why would they show openness to us? Because we have power over them in the grading. So I think it's critical that we model these feedback literacy dispositions and activities. So what I'm going to try to do, and I'm going to try to talk for about another 30 to 35 minutes so that we can have a bit of time for discussion at the end. but I'm going to try and give an overview of some of the key challenges, how feedback literacy can be part of the solution. I'm going to draw on some studies of medical education feedback, including one done by myself, and then end in the normal way with a few recommendations. But I want to start with a story. Around 25 to 30 years ago, when I was starting out as a teacher in Faculty of Education, training teachers for work in schools. And you know how it is with courses. We typically have assignments or exams at the end of the course, and then the teacher will do some marking. Now, in education, we don't have so many exams. We often have assignments. So I already had a feeling, even as a very young teacher, that doing a lot of comments and marking at the end of the semester when the course was finished probably was not going to have much impact on the students. So I used to do it at the weekends or the nighttime. I wouldn't use the sort of core daytime hours to do this kind of work. And then I would mark on the hard copy. Then I would send a message to the students. I've left all the assignments outside my office. Please come and collect them and see the comments and hope they will be useful. And you can probably imagine what happens. What we call feedback graveyards, or my colleague and co-author Naomi Winston calls feedback graveyards. These uncollected assignments. And from the student point of view, I think it makes sense. The course is finished. The grade is awarded. You may never see this teacher again. Why would you go and collect these commentaries? So I think that is not really feedback. I think that is marking. And I think we need to make a distinction between marking and feedback. So that was the old days. Now we have the e-learning equivalent, check the grade and log out. So now instead of the hard copy, it's on the learning management system and the students are told the comments are there. And naturally enough, the way universities are structured, the grade is king. So once they've seen the grade, actually, why should they read the commentary? Of course they might, and if they're diligent students, they might be able to get some insights to transfer it, but it's difficult. So it made me always think that the way we should be designing our assessment is one assignment in the middle, followed by feedback, then a second assignment at the end, where hopefully the students can use the feedback from assignment 1 to help with assignment 2. And to me, that is teacher feedback literacy, when we're designing assessment and designing curriculum in ways in which the feedback process can come at the right time and can potentially lead to action. So to summarize what I've said so far, end-loaded assessment is one of the key issues. And then I asked some of the students in my research, why do you not come and collect the assignment at the end of semester? Why do you not read the comments and see if there's anything that you can think about? And one of the students, he said to me, if the grade was low, I would not go to collect the assignment. And this struck me as low student feedback literacy, because my assumption was if the grade was low, he was doing something wrong. So there'd be more reason for him to understand what the problems were so he could fix the problems. So I said to him, why not do this? And he said, the reason I got a low grade is the teacher doesn't like me. And sometimes students feel that you think if they got a high grade, it's to do with the teacher liking them. And if they got a low grade, it's the students not liking them. We know that is not the case. We know that we are grading according to the qualities of the work. But the students sometimes are overwhelmed by the emotions and the affective feelings. I think the other dimension at play here is the teacher workload. just like I've said, I kind of had a feeling that this end of semester marking wasn't going to be very useful to the students. So I wasn't fully committed, and then the students weren't fully committed. So I think this kind of feedback seems to be not very productive. I don't know if you guys have time to do social media at all, but I used to like doing Twitter because I used to pick up a lot of good ideas. People will recommend articles that are some good readings, good literature, people with different academic interests, and I could pick up on things that I wouldn't otherwise have come across. And I was looking at LinkedIn a few months ago, and one of my collaborators and colleagues, he posted a few thoughts about this book. And I have this book on my bookshelf, and he reminded me to look at it again. It's about feedback in daily life. It's not about feedback in universities. And revisiting it reminded me of a particular critical feedback problem. And I think you'll be able to relate to this one. When you do a staff appraisal, either as an appraiser or as an appraisee, when you get feedback from a colleague, when you give feedback to the students, we tend to mix up these three functions. We're trying to give some encouraging comments, but we're also trying to give some coaching or improvement comments. And we may also have to give a grade. And I think in practice, in the mind of the feedback giver and the feedback receiver, these all get a bit confused. And I'm sure you've heard of the feedback sandwich, which goes from appreciation to coaching to appreciation again. And the messages tend to get lost. So I learned from this book that what we should be doing is saying to the person we're appraising, there are two things I'd like to share with you. One is the things that are working well, in other words, the appreciation and encouragement function. And secondly, the things that are not working so well, the improvement function. Which would you like to do first? So we bring the other person in, and then we try to make it clearly whether we're doing the appreciation and the encouragement, and we do that, and then we do the coaching and the improvement. But in feedback conversations, I think these get muddled together. That is a major barrier to all kinds of feedback interactions, including between you and your husband or wife, boyfriend, girlfriend, your teenage children, etc., etc. And it can be very difficult to give feedback in daily life. And I think it's partly to do with these confused functions. So I was browsing through this book and I looked at the back cover. And on the back cover, you get some endorsements from different people. And I saw the name on the back cover of a professor, and I'd never heard of him, but he sounded interesting. So in the last 2 or 3 weeks, I've been checking out a professor of organizational psychology called Adam Grant. He was the youngest full professor in UPenn in the States. Every year, he's the #1 teacher in the university. And he has a kind of mindset that I think is very inspiring and very meaningful. So I want to spend the next 3 minutes or so telling you a bit about Adam. He went to Harvard University, and when he arrived, they gave them a written test. I think the written test was mainly for the non-native speakers of English so that they could be put into a group to get a bit of remedial support. Adam failed this test and he was put into the group that needed extra support on writing. And they said to him, Adam, you're not a very good writer. You don't write clearly. Your writing is not very well organized. He's written 10 books in the last 5 years. They are all, sorry, 5 books in the last 10 years. They are all bestsellers. He's an award-winning professor. He's made enormous amount of contributions to the literature. When he started teaching, he was very nervous. He describes himself as an introvert, a very shy person. He used to sweat a lot. His anxiety was communicated to the students. What he did in his first year of teaching, and he does it every year, is in the middle of the semester, not at the end, but in the middle, he gives the students a survey about basically how could he do better? What are the things that are working? What are the things that are not working? How can he do better next time? And I've only discovered this scholar in the last 3 weeks, so it's kind of inspiring me. And I'm asking you to tell me today, how could I do better next time? So Adam collected this feedback on his teaching from his students, his undergraduates. What he wanted to do next is feedback sharing. This is an innovative concept of Adam's. His colleagues told him, don't do this. If you share this feedback with all the other students in the class, they won't respect you. You will be humiliating yourself. But he said, I want to be transparent. I want to model for the students the willingness to listen to feedback, to process it, and act on it. So he sent all this negative and critical feedback about his teaching to the students. Then in the next class, he thanked them for the feedback, and then he told them how he was going to try to improve his teaching based on their feedback. And then he's done this process every year. And like I say, now, from these difficult early beginnings, he's now become the top-rated professor in his university. So basically, his feedback argument is, it's not talent, it's not natural skill, it's how can you do better every time, gradually, gradually, gradually. So if you start from being average, but you can get 1% better every month, every semester, every year, you can go from a relatively low beginning to a very high level. And his stories in his TED Talks and in his YouTube, they kind of illustrate some of this. He talks about a lot of other topics other than feedback, but feedback obviously is the thing that I latch on to. So if you could give me some feedback either through the process that Joyce and Simon are setting up, or you could tell me what key challenges I've not addressed, what could be cut or reduced, what would you like more of, what would you be like less of? I cut 4 slides this morning. I had 38 slides yesterday and I'm down to 34 today, which I think was good. But the proof of the feedback pudding is in the eating. So I would love it if one of you could, or 2 of you could email me in 6 months' time and saying, I tried out something you suggested, but it didn't work. Can you give me any more advice? Or I tried something from your talk and it was successful and there was this and there was that. Because to me, what I'm hoping to stimulate is a conversation and some reflection that might encourage you to change your feedback practices in some smaller or larger way. So my feedback principles, and I hope Adam and myself we've illustrated a little bit, is that the self is the critical player. That I can only improve if I want to improve. Your students can only improve if they have the desire. And the self is possibly the most important player in feedback practices. Now, that could be challenging because probably before this talk, you may have thought your job as an educator is to give feedback to the students. But people do not like being told what they are doing wrong unless they've asked for it. So it's a very critical step. When a person says, I'm not doing so well in the way I examine the patient, sometimes the patient will feel uncomfortable or the baby will cry. How do you handle this situation? Can you help me? So the self, I think, and self-evaluation, and I know in medicine you have some famous Pendleton rules, and I think they're very much based on starting with the self, starting with reflection, and trying to lead to future action. So I think my critical principle for feedback is that it needs to be actionable. Where I started, those feedback graveyards, was feedback that wasn't really actionable and wasn't leading to positive impact. So I think what we're looking for is feedback processes that are not excessively workload heavy for the educator, but they have some kind of impact. And I'm getting feedback from Adam Grant by sitting on my sofa at 9 o'clock in the evening and listening to his YouTube talks. And that's giving me feedback and inspiration. So feedback does not have to come from a teacher one-to-one to a student. That's too labor intensive. There's got to be other ways. And this is where feedback literacy comes in. I'm trying to show feedback literacy. I think Adam Grant shows an incredibly high and rare level of feedback literacy. And I define it basically informally as how to make the most of feedback inputs of different kinds, how to generate feedback. Adam was generating feedback from his student, reflecting on it and using it. And it can come from the internet, can come from YouTube, can come from the textbook, it can come from your peers, your friends, your spouse, your children, etc. This, I think, is a very important slide because it's encapsulating the way I orient feedback around the self. My argument is that the self is the most important player in feedback processes. I'm backgrounding the teacher somewhat. The teacher plays a role, but less as a feedback provider and more as a designer of learning environments, a facilitator rather than a feedback giver. Well-designed peer feedback, formally or informally, can be very powerful. And of course, now generative AI is a potentially very powerful form of idea generation, workload saver, and feedback generator. We can ask questions anytime, any day, and generative AI will give us some inputs. Teachers, yes, but they could well be helping to identify the strengths and weaknesses of the peer feedback or the generative AI feedback or the self-feedback. So to me, one of the best roles of the teacher is to give a comment on the student self-assessment. So the student self-assess first, and then the teacher comments on their self-assessment. So my formal definition of feedback literacy from the learner point of view is the understandings, capacities, and dispositions, such as vulnerability, humility, needed to use feedback for improvement, this uptake and action dimension. And I have a framework. The parts in italics are the updated ideas, but I have this fourfold framework of appreciating feedback, seeing its potential value, thinking feedback is something that can help me. Feedback is not just somebody else scolding me, but it's something that could be a useful concept for me to engage with. Secondly, making judgments. So making sense of whatever feedback inputs we get from peers, from generative AI, from the environment, deciding whether they make sense, deciding whether we need to look for further information. Do we need to go to another peer and ask them their view? There's the emotional side that I've talked about a little bit. I previously called this managing affect, but some people said to me that sounds a little bit negative. So working with the emotions, channeling our motivation, channeling our drive, trying to get these kind of dispositions for moving forward. And then taking action, I've now modified to taking deliberative action. I'm building on Erickson's ideas around expertise, and that the core to expertise is deliberative practice. It's not just practice, it's deliberative practice. So taking action could mean we analyze the feedback and we decide it doesn't work for us, so we don't follow it. I think that's still an action. If you've reflected, decided it's not going to work, talked about it with a peer, but if you don't engage with it or you don't read it, clearly that's not action. So that's from the learner or student perspective. What am I thinking that a teacher will do? Well, it needs to be a shared responsibility. I am putting the learner and the student at the center of feedback enhancement, but I think the teacher can facilitate. And I think the main way we can facilitate is through design, curriculum design, assessment design, feedback design. The way the curriculum is designed and the way the assessment is designed is going to be a significant factor for how effective the feedback processes might be. As I indicated at the beginning, if it's one big exam at the end, it's going to be quite difficult to bring in a feedback process. But you could invite some of the students who took the exam last year to come to your class to share some of their revision strategies, to share some of their ideas. You could give your own perspective as a marker. You could say, usually when students take this exam, they usually struggle with this particular concept. So even with an exam, we could try in the preparation phase to give some kind of preemptive feedback. But generally, the way we design the sequences of maybe trial and error and retry, draft, redraft, the way we try to design cycles has more potential for feedback. Sometimes when I do these talks, a teacher will say to me, I have a class of 200 students. How can I give feedback to 200 students? I would think quite similar if I had a class of 20 or 30. If I have a class of 20, I don't usually give them a lot of individual feedback because it's too time consuming for me. I think it's also too teacher centered. If I'm centering the self, the more feedback I'm providing, the less the more I'm inhibiting their own self-assessment. So I see the role of a teacher is to be an orchestrator, a conductor, a facilitator of potential feedback sequences that are rich in self-assessment, peer feedback, and generative AI. The teacher is there to help and support, but I don't see in higher education the teacher as being the main feedback provider. Because I think higher education has to be about autonomy. It has to be about critical thinking. And I think it's too limiting to think the student should be told by a teacher what to do, because that's not sustainable. We're trying to create lifelong learning. Now, some people say I'm too idealistic, but I think we need to have some ideals. We need to have some principles that underpin our feedback practices. Okay, in the penultimate part of the talk, I want to just give a little bit of a flavor of some recent examples of the feedback literacy ideas that I've been pioneering for the last 6 years, how they've been taken up in medical education research. And I should say I'm particularly interested in how feedback plays out in different disciplines. So I did one study that tried to look at feedback in architecture, feedback in engineering, feedback in education, and feedback in medicine to try to see some of the similarities and differences. I don't know if you're familiar with the R2C2 feedback and coaching model, but it's quite a well-known concept in medical education. And there are some famous names from the medical education literature in this paper: Subramani, Joan Sargent, Jocelyn Lockyer. And the essence of R2C2 is 2 R's and 2 C's. It's kind of 3 R's in a way: relationships, responses, and reflections. That's the 2 R's. Content of the feedback and coaching for change are the 2 C's. Now, to me, the challenge of the large class is not so much that you cannot give feedback to 200 students, because I don't think you can give feedback to 30 students or 20 students or 15 or 10. I think it's perhaps in the relationships. If the smaller class, we can maybe learn the names, we can build up the trust, we can build up some of the dispositions. So that's where I think it is a problem, it is a challenge. But I think, as Adam Grant does, we can show humility, we can reveal vulnerability, we can elicit feedback, we can model the dispositions. And I think you can model the dispositions just as well or even better in a large class as you can in a small class. Another reason I like this model is they finish with a co-created action plan. So that is the educator and the learner, the student, trying to make an action plan for improvement. And I think we all need action plans. And when I do staff appraisal with my colleagues, we sometimes work on action planning. So I think action planning is a very important step in feedback uptake and the deliberative action on feedback inputs. The second medical education paper I'd like to look at, again, is a very recent paper, and they tried to relate some of the feedback literacy ideas of myself and others to medical education. And I've extracted one part that I particularly appreciate because I think it supports one of the key messages I've tried to share. When I talked about the teacher as the orchestrator, so feedback has evolved from how to give feedback to understanding how to create feedback interactions. I think I would have said sequences or processes. I prefer the word sequences rather than interactions, but I'm basically on the same page with these authors, which optimize learner uptake. So again, they're focusing on avoid the feedback graveyards, avoid the check the grade and log out. How can we construct interactions or sequences which encourage students to reflect and to use feedback? I want to now give an example. Sometimes when I do these talks, people say, I want an example. So I've chosen an example from medical education, which I was involved in. So around 6 years ago, I went to the Queen Mary Hospital with one of my colleagues in medicine, and we observed the students doing their clinical clerkships. So I was in a group of 7. There were 7 year 5 undergraduate students. They were in the pediatric ward, and they were doing like an internship where they would examine the patients, and their professor was going to give them feedback on how they performed the examination of the patients in the Queen Mary Hospital and how they did the diagnosis. So I think you guys will be familiar with this kind of bedside rounds. To me, one of the powers of it is that the feedback is based on direct observation of an authentic thing that doctors will do. Because there's only 7 students and 1 medical professional, you can have a dialogue and a clarification in a one-to-one. One of the other special things I noticed is you can also demonstrate. So at one point, the medical professional showed the student how to press on the abdomen in order to understand better the stomach problem that the child was having. Took about an hour and a half. I don't know if that's typical for you, but for 7 students and 7 different patients, about 15 minutes, 10 to 15 minutes per patient as we walk round the pediatric ward. And we call this authentic feedback because the practices and the context and the situation is resembling those of the profession of medicine. And you can imagine in other disciplines how this might work. One of the things that I found very interesting and very meaningful was there was a lot of what I call interrogative feedback. So the medical professional asked the undergraduate students these kind of questions. She questioned them a lot about their thinking process and what they were doing and why. And this made it something of a feedback dialogue. She asked the question, they gave the answer, and then she made some commentary. So that was one of the things I very much appreciated. And a certain amount of my feedback in my daily life is working with doctoral students, PhD students, EdD students. And obviously I'm having one-to-one tutorial, and I do a lot of interrogative feedback. What is the rationale for your course of action? What are the pros and cons of this data collection method? What are you going to do next? What do you think are the challenges? What do you think the examiners would say when you submit your thesis for examination about this strategy, etc.? So I think interrogative feedback is powerful because it gets the self, engages the self, which I see as the center of feedback. And I think a natural mistake we make as educators is to talk too much and to tell the other person what to do. The more and more I think about feedback, people don't really like to be told what to do. They like to have a conversation. And if they tell them what they think first, and then you give a commentary on what they think, I think that's quite an important difference. But I should say in practice, I sometimes forget the principles. Some of the things that I thought could have been even better, setting the scene for feedback. I made a terrible mistake a few months ago. I'm supposed to coach and mentor my colleagues. And I saw my colleague in the corridor, and he's a Western guy. He's my age. I thought we had the relationship. And I just sort of went straight in there and made what I thought was a constructive suggestion. But it upset him, and he thought it was unfair. And it's kind of a little bit spoiled the relationship between the two of us. I failed to set the scene for feedback appropriately. I should have said something like, can we go for a coffee tomorrow? I have an idea. Are you up for me giving an idea as how you could be even better in your work? And I know you're a really great guy, and I really love you so much. I want to help you get better. I just jumped in there and said my comment, and it was a big mistake. So I think setting the scene for feedback is important. Saying to the students, you're going to do this activity. There will be some things that will be quite good, but there's a lot of things you'll need to improve. Do you mind if I give you these comments face to face in front of everybody else? Is that okay? And hopefully they'll see the sense of it, and even if they feel some emotional reaction. So I think I need to do a better job of setting the scene for feedback, and I think all of us do. We're busy, we're sometimes in a bit of a rush, we want to just get on with the job, and I think setting the scene is important. And I think the next slide also elaborates on that. You can imagine these 7 students in the pediatric ward. They were mainly focused naturally enough on their own performance. They had like 10 minutes in the limelight when they were doing the examination and they were getting the feedback and the appraisal. I didn't think there was quite enough learning from observing the other students doing it. The guy who went first, he did it first, and then he kind of chilled out and relaxed in the background. And I think the educator maybe could have stimulated a bit more vicarious learning, or even try to keep the students more engaged by occasionally saying, well, John, what would you do in this situation? Joyce, what did you think about that? Did you think, why do you think the baby cried? Is there anything we could have stopped the baby crying? You know, I think there could have been a little bit more peer feedback. But when I said that to the educator, she said, well, we haven't got so much time. And I think that's true. But I think these things are so important to spread the feedback around the room that we shouldn't dominate as teachers. And then my last thing is I've been going to hospitals for 50 or 60 years and as a patient or going to the doctors, and I was seldom ever asked for any feedback or as to what I thought of what the doctor was saying, whether I could understand. So I wonder whether with 360-degree feedback, we could be getting more feedback from patients. I know you do that sometimes, but I don't think it happens very often. And I have to say, a doctor has never asked me really what I thought about the way things were going in the very brief interaction. And I just wonder whether that might be something that more could be done of. But feel free to contradict me if it is happening more than I think it's happening. Yes, so setting the scene for feedback. Adam Grant says before any verbal one-to-one feedback, we should say something like, I'm offering these comments because I have high expectations of you and I know you can reach them. I really want you to reach your potential. So can I give you some critical comments? And I think that's building relationship and building psychological safety, that both in the organizational literature and in the medical education literature is quite an important issue. Trust, respect, a feeling that you're open to being critiqued. And I think teachers need to model this for the students. Because you guys are doctors, you've got a very high status. It's very easy for the students to be a bit intimidated. But if you are brave enough to reveal vulnerability, they would be more willing to also reveal vulnerability and tell them the things that they don't know and tell them the things that they're struggling with, particularly in the clinical practice. Some of our brilliant high achievers, I think they find it quite difficult to communicate to the rank and file, working class patients, etc. And sometimes how sharing how we deal with these challenges of communicating with different people from different backgrounds, different languages, different cultures. I think these are important skills that if we show humility, we can open up the feedback literacy box. Okay, in the last 2 or 3 minutes before I open up, I just want to briefly share some takeaway messages. So set the scene for feedback interaction. So we're on the same wavelength as to those 3 functions. Is this encouragement? Is it coaching? Or is it grading? And preparing the ground. I think you have great potential. I think if we had a conversation, I could help you reach your potential. Are you okay with that? And then you go on. The self is most important, so I think we need to partner with learners. I think we develop feedback literacy together. The beginnings of my feedback literacy were seeing those uncollected assignments. When the students didn't come and collect the assignments, it made me think about the sequencing of the tasks. It made me think about timing. It made me think about the issue of feedback action. So when my students tell me things about feedback, it helps my feedback literacy, and then it helps me understand them, because to me, feedback is for them, feedback is for the learner. So I think we must partner together. So I think the mistakes we've made in the past is sometimes thinking that feedback should be clear, feedback should be specific, feedback should be constructive. Yes, but it should be to do with the person we're talking to. It should build on emotions and relationships and future actions. Because clear feedback that upsets them so they ignore it actually doesn't help. So I think we need to change our mindset a little bit to the impact of the feedback on the learner and how they can do better next time. And then I suppose my question for universities or for medical faculties is, do we have the kind of climates and cultures where these kind of feedback processes can flourish? I know relationships are difficult because we have large classes, we have hundreds of students. How do we develop these relationships? How can we reveal humility and vulnerability? But I hope I'm doing some of that, and I think Adam Grant was a good example of that. Are we willing to admit our mistakes? I think if you do an operation, a surgical procedure, and something goes wrong, I think you have a kind of debrief. But I suppose there are a lot of issues there if people don't want to be blamed, particularly if something bad happened. And then finally, the idea that we've got mutual development of staff and student feedback literacy. So I'm going to share the slides with the organizers. I put quite a few medical education references there in case any of you have the time or the interest to follow up. But I think I did the timing okay, and we still have 10 minutes left. So open it up for comments, but I'd be really loving it if somebody said to me, David, this was pretty good, but next time it would be even better if you would do a bit more of something or a bit less of something else. But over to you.
Thank you very much, Professor Carless, for that very comprehensive talk. I mean, obviously you touched on many aspects of not only student but also teacher feedback literacy. So I'd be interested to hear from the audience. We have a lot of very keen, enthusiastic teachers in the audience. So let's see if anyone has any questions. So if you have any questions, you can turn on your mic and your video if possible, and then you can ask away, or you can put your question in the chat box and we can read them out as well. So any questions, open to the floor. So while people are preparing, oh, Joyce and Carmen, let's have Joyce. Her hand went up first, I think.
Thank you. Thank you, Professor Carless, for the presentation. I really learned a lot. I'm gonna put my sort of feedback at the back. I'll ask a question first, perhaps. From my experience of asking students to sort of give feedback to each other, like a peer review, I want to ask for your advice or your experience. You've been working with local and perhaps international students. I think from my experience, the students tend to be very polite when they give their friends comments. So a lot of times it ends up with, good stuff like, oh, I think he's done pretty well, da, da, da. How can we, other than preparing ourselves and the environment to be sort of psychologically safe, how can we also prepare our students to give like feedback that would be useful instead of just being friendly and kind? Maybe it's the culture thing, maybe it's the...
I'm going to say something that will surprise you all. The main purpose of peer feedback is not to get insightful comment from your peer. The main purpose of peer feedback is for the peer to compose feedback, because composing is more cognitively rich than receiving. So if the student gave peer feedback to the other students in the clinical clerkship, the feedback would not be so authoritative as the teacher. So if you think that peer feedback is about a student giving feedback, it's going to be disappointing. But I think it activates the peer who gives the feedback in terms of what are the qualities of good performance, what are the characteristics. So the peer feedback giver learns more from the peer feedback receiver. And then secondly, I think in peer feedback, we are learning through comparison. So when you go to a conference and you see the other people present, you maybe look at the design of their slides. You are learning about how to present at a conference. You are learning about how to design slides. When you listen to a TED talk, you notice they always tell stories. So it makes you think that when you do a presentation, telling a story is a good strategy. So I think we learn through comparing our own work in progress with that of other people. And if you think of when you apply for a research grant, probably the first thing you do is you ask a colleague who got that research grant in the past, can you look at their example? So we're learning from exemplars. So peer feedback, very complicated, but I think we learn more by composing than receiving, and we learn by comparison through examining how other people are doing a similar thing to what we are trying to do.
Yeah. So it's also a change of mindset when I'm trying to ask the student.
Yeah, and we need to explain that better to the students.
Right.
Because usually their main objection is the peer didn't give me much insight. They were too polite, not authoritative. If you explain it in the way I have, and you can encourage them to buy into it, they can see it in a different way and it's more meaningful.
Thank you. So my feedback for you is I really enjoyed the session, and I have been reading Adam Grant's books. I haven't finished Hidden Potential, but absolutely, I think from his own life story, he benefits from a lot of being vulnerable to receiving feedback. I like your pacing a lot. I like the examples that you give. Because I invited you, I won't give you bad feedback. Thank you.
But you're cheating me, Joyce. You're not telling me how I can get better. So
I need to improve my feedback literacy.
Carmen.
Hello.
Hi.
Thank you. That was a brilliant presentation. It actually wrapped up quite a few things that that's been going on in my mind about design and feedback. So I just want to a couple of comments and maybe your feedback on that. So when you talk about Adam Grant and doing that in his courses, getting sort of feedback from students. So I do design thinking in curriculum, and one of the he's a design thinker as well, and he says he does this particularly when he's got like like a 13 weeks to work with the students over a semester, right? So he does the what should I stop doing, what shall I keep doing, and what do you want to see more of, right? And not only does he receive that from the students, he also gives feedback to the students as well. So midterm, he would also say to the students, what do I want you to stop doing, keep doing, or doing more of? Which I thought is like another element of it, which was, I thought that was quite good. So welcome comments on that. And then the second thing is about, giving examples. So I can see that there's many sort of clinical people here. I just want to share an example that we've done in family medicine. So what we've done we've taken some of the OSCEs and we've put them earlier on. So we put them sort of midterm. And they're kind of like, if they pass first time, we do it by video. So they do a history taking, they do a video. If they pass, they pass. We get out the borderline people, the people that fail, and then we have a session with them. And in that session, it is about that kind of that self-reflection. What did you think that you did well or not well in your station? And then what I do with them as well is then role play. So they become like examiner, they become like the patient, and they also become like the doctor. And I think that kind of reinforces what you said is about the self, but also it's about observation about other people and having that air of like the evaluation. So what Joyce was saying, sometimes I feel that students, it's not that they can't give feedback, is that they can't construct that feedback and what they feel is right or could be improved. And I think that during that session, when they first come in, they're always like, where did I lose that 1 mark to pass, right? Okay, and that's their thing, mark. And I think just having that session that is framed to say, well, look, we can talk about that later, but what we want to focus on is how to make you like better. So it's not, there might be things that you realize that you might be doing not so well that you could improve on that would actually improve your performance. And usually by the end of that session, they are much more accepting of that. And I think that the important thing is about framing, that they have that session and that is, and that is what we're going to talk about. And sometimes as clinicians, it's quite difficult because we don't get students for a long period of time. We might get them for like a session. And so the other example is that when we have them in FM clinic, they know that session at the end, they're going to receive feedback. There's like an evaluation and we're going to do some feedback. And so telling them that right in the beginning of that session, or even in the beginning of the module, that there are these sessions, also takes away that, when you're talking about we have to frame it in advance, but sometimes you don't get to do that yourself. So I think that it can also be constructed, designed in the course so that it can be within that sort of package. Yeah. But I thought that it was really interesting just to see how parts of that had come together and what we can do with constructing those kind of spaces within the curriculum. Anyway, any comments?
Yeah, thanks, Carmen. I fully subscribe to what you're saying. I think in Hong Kong U, the OSCE is more of a evaluation tool than a coaching tool. And I think our students tend to feel it's like a pass-fail kind of thing rather than how might we do better in this kind of situation in the future. And I think the way you're doing it sounds like it's trying to overturn that kind of paradigm. So I fully applaud what you're doing. Thanks.
What do you think about giving students feedback in the middle of the module in the same way that you're receiving feedback?
Oh yeah, I like that. I mean, I like the whole process, and I think it's like the shared partnership, isn't it? Because Adam is welcoming the feedback and he's processing it and he's sharing it, and then he's telling the students what he's going to do. So I think if he wants to also help the students to get better, that I think that's mutually reinforcing, and I think that's kind of ideal. Yeah, so I think that kind of strategy is just the kind of thing we should be doing.
Thank you.
Thanks.
Well, thank you, Carmen. And so do we have any other questions? Oh, I think
Hi,
Tony
Simon.
switched us monitor on. So Tony?
Yeah, a quick question. Yeah, thanks very much. Yeah, I mean, one of the, I guess, key forms of feedback is CTE scores, which is part of, I guess, academics advancement. And so how would you sort of view CTE scores as a form of feedback? And could you maybe improve it that it's more useful for the teacher and maybe less, you know, part of a promotional thing in a popularity contest?
Sorry, Tony, you used an abbreviation. I think you'll need to explain it.
So continuous teacher evaluation scores that go to the university.
Oh, yeah.
CTE.
Yeah. These kind of student ratings are to do with whether the student likes the teacher mainly rather than the effectiveness of the pedagogy. So I think they have relatively limited usefulness. I think it's much better to do a tailor-made evaluation of the teaching in the way that Carmen and Adam and I have just been discussing midway through. Anything that comes at the end is a little bit not super useful. I think it's quite useful maybe to us early in our teaching career when we're not too sure how the students are reacting. But I think one way to rescue it is at the beginning of the following year, you tell the students what the feedback from the previous year was and what you are doing to tackle the problems that were identified in the past. Because I think we asked students to fill in a lot of these forms, and I think they find it a bit boring and tiresome. And I think it's because nobody feedbacks to them what action we took or what sense we made of their comments. So this is a quality assurance procedure we have in our university, and I think it's a good one. I don't think many teachers actually do it, but what we're supposed to do at the beginning of every course, we're supposed to introduce the course, share the module outline, and say to the students, the feedback on this course last year was blah, blah, blah. What we've done to strengthen the course in response to that is blah, blah, blah. And I think if we did that regularly, it would be quite a neat strategy to model reflection, to model processing of feedback, and to model listening to the student voice. Do you think that kind of thing might help, Tony?
Definitely part of the issue. I mean, I think the other part is sometimes some feedback is from a very negative student and some from a very positive student and may not be reflective of the whole class. And I'm not sure how one solves that problem either.
I suppose the other thing that people do, and we've started doing it in this university, even though it's a bit controversial, is peer review of teaching. So now before anybody goes for promotion or contract renewal, somebody has to go in and fill in a form and observe their teaching and report back on it. Now, that could be perfunctory, it could be procedural, it may not be entirely objective, but it's adding another source of feedback. So if we've got three sources of feedback, the teacher's own reflections, maybe their teaching philosophy, their own action planning for improving their teaching. We've got, secondly, the student feedback data. Thirdly, we've got peer review from another colleague who could be a same discipline or another discipline. They could come from your academic development center. So I think maybe each of those three strategies have their pros and cons. And I think the triangulation of the three is much more powerful than just relying on one source, because as you say, it could easily be biased in favor of certain genders, ethnicities, age. And usually the taller and better looking you are, the more they like you. So it's not always about pedagogy. Maybe even they should change the questions a little bit so it's more like, what did the students do in response? So it's not so much like, I like the teacher, but it's, I did more reading on this course because of this way of operation or something like that. So focusing more on the student rather than the teacher, that encourages a kind of charismatic professor stage on the stage kind of image.
Great, thank you.
I've got a question from the chat room. So this is from Kay, who's a doctor in Department of Surgery. Her comment is that she understands medical counselors recommending that we give some regular formal feedback to students. So her question first is anyone aware of any written feedback given to students, and any advice on this, and any, especially regarding the timing? So I don't know if Professor Carless has heard anything about this, or if Carmen or Joyce would like to talk about this.
Maybe first I could make a very brief comment. I think this is quite a big challenge. In sometimes there can be like accountability forces and procedures and accreditation that requires certain formulas. And sometimes these formulas and things like anonymous feedback. Yeah, sometimes these can be barriers, I think, to the kind of relationships and forward looking, but I'm afraid I don't know the details of that scheme. So maybe Carmen and Joyce may say something.
Carmen?
I'm not sure whether I've got the right context. So with regards to written feedback, what I have done with groups before is that generally, because it's quite hard to feedback, particularly if they've done, like everybody's done quite well. I feel like, I think I tried starting that, and then it's very hard to give everybody feedback. So sometimes I do like a class group feedback, but I just send them like written, because I haven't got a chance to get them all together. So I'll send them like a written feedback of things that they've done well and things that they were common sort of misconceptions about certain things, to a whole class as a written thing, but I'm not expecting them to sort of get feedback back. And I think that, yeah, so I'm sorry, I probably got the wrong end of the stick, really. Kay, was that something that you were talking about, or is it is it not? Simon, have I answered your question, do you think?
Well, I think you've answered part of it. I mean, if to supplement, I think we need to have faculty level sort of understanding how or what we want to do. I mean, it's because of the way the modules are generally structured, most of the feedback is given after the examinations formally. So we don't have any formal feedback mechanism early on. So I think that's a big issue that we probably need to have more discussion about. And I think it's very labor intensive to give feedback, isn't it? So so we need some mechanisms, i.e. technology or something like that, to help us regarding that. And I think generative AI can help with some level of the feedback, I think, but obviously that's something we need to look into a bit more. So
sorry, I've managed to turn on my computer. Hi, I'm Kay.
Oh.
No, thank you, Carmen. No, it's just that no, I think we all know that feedback can be very meaningful, and this group, I think, are already doing lots of great feedback, but unfortunately, we cannot be in every place to give every student feedback, and I think encouraging or empowering the teachers how to give effective feedback is maybe where our role is as educators, to teach them or give them some tips to how to give feedback, because I think the feedback, as you say, is an art that and as you especially you said in a great way, that they need to be ready to receive feedback. But I think most of the teachers, I think, out in the clinical area have been taught in the era where they're kind of told, shown that you were making mistake, and were told how not to do things. So we need to educate, I think, everyone how to give feedback so that it can be effectively given. But we've been trying to think of effective timing, and often the times when they have time to do assessment is usually at the end of the year, where it's too late for the students take on that advice and make any difference. And they kind of feel that, oh, they finished their time with GP, so I don't really need to know any feedback for this. Whereas we probably can give some general feedback that can improve their performance for their future career. But we've been trying to kind of generate time for feedback, but doing it during their attachment is time consuming, and actually finding the time and the manpower to do it's been difficult. And with the council kind of pushing us to do it, we've been thinking whether we need to do some sort of written feedback so that there's evidence that we have given feedback, or whether giving feedback during teaching sessions on one-to-one basis when we can is enough. So I was just kind of reaching out to everyone to see what everyone was doing, and if you can give us some guidance or tips.
In general, I think we have to fight back against time-consuming practices that don't seem to have that much potential impact. I think sometimes this written feedback at the end, there's a danger that it's relatively time-consuming for the instructor.
Agreed.
And relatively low impact for the students. And I think at a institutional or departmental level, I think we should try and fight back against that, because our time is limited, and we want to invest our time and effort into things that are valuable, satisfying, useful for the students. And I think that's why having a conversation with the students is very important. I think when the students say this kind of end of course written feedback isn't very useful, I think it presents a rationale for doing less of it, and then either saving time for something else more meaningful, or trying to have some more feedback process earlier, or in conversation, or through online or digital or Gen AI means. But I think we have to try and fight back if we can, and try and maybe get our leaders and our heads of department to support us, because you guys are so busy and there's so many valuable things you can do. You don't want to be investing a lot of time on a low impact activity.
I think, Kay, you've raised a really good point, and I think that we should actually value a lot of the even written feedback. I think a lot of it happens even in the sometimes in the year meeting or informally, but it may not get carried across, as Dave was saying, what changes, and it's kind of like hearsay. So I do feel that if we have a process of like written feedback, I think that would also highlight to teachers and to the faculty how important feedback might be. And so I think that, one of the take homes from this, I think, is, how to bring it back to the deanery, Simon, as well, and and think about how we can, that feedback plays a greater role, and also about the culture change of, of kind of receiving feedback, and feedback is part of what we do, and having that, it'll take some time, but yeah. So I think it's good what you raised.
Well, I think we're actually doing a lot of the stuff. It's just that we don't do the final looping back to the student. So I think, I mean, that's something which we could do if people are happy with being more transparent. But obviously that needs to be prospectively, defined, because, then we all know what we're going to do, and then the loop can be completed. Yeah, so we're not quite completing the loop at the moment, but it's something we could definitely think about. So I'm a bit conscious of time, so I think we've exceeded the allotted time a little bit, and I'm sure there's still many questions. So if you have any further questions, I'm sure we'd be happy to forward your questions to Professor Carless, or you could also directly email Professor Carless if you have feedback. Then also email Professor Carless. I'll promise to send you my feedback later on, and not give it to you publicly and waste any more time. If any questions, please let us know. If you have any feedback for the organization, also let us know. Also, I want to plug this as part of a faculty development series that Carmen and Joyce are working on. So please keep your eyes peeled for any further sessions, and also encourage your honorary staff also to attend. So thank you very much all for attending. And yeah, so I guess we could split for our clinics and operations and everything that we need to be doing. Thank you.
Thank you.
Thank you.
Thank you.
Thanks, everybody.